Good evening and welcome to the COVID-19 update on Channels Television. I'm Millicent Nwaka. First, the highlights. Sokoto State Government says 0 cases recorded in the state in over 100 days amid testing for COVID-19. Yobe government and WHO partner on mental health training program to increase recognition of mental disorders and enhance appropriate response under the pandemic. And China administers more than 1 billion doses of its COVID-19 vaccines, a key milestone in the world's largest inoculation drive. Despite the cases of the coronavirus being on the rise in Africa, last night no new confirmed case was recorded in Nigeria. The death toll also remains the same at 2,117. Let's remind you of where we are.
The trend of low COVID-19 daily figures has continued over the past few weeks, and the latest figures coming from the National Center for Disease Control, NCDC, shows that Nigeria recorded 0 new infections in the last 24 hours. The latest update, however, did not include data from Lagos State and 0 cases from FCT, Imo, Sokoto, Nasarawa, Oyo, Ekiti, Kaduna, Edo, and River State. Till date, a total of 167,206 infections have now been confirmed in Nigeria. There were no new deaths from COVID-19 complications, and the fatality toll still stands at 2,117. 7 patients were discharged in the last 24 hours after recovering from the virus. The total number of recoveries in Nigeria stands at 163,557. The latest update by the National Primary Healthcare Development Agency shows that more than 2 million eligible Nigerians have been vaccinated with the first dose of the Oxford AstraZeneca vaccine, while over 800,000 of those vaccinated with the first dose have now received their second dose. According to the agency, Lagos State is taking the lead after vaccinating over 156,000 of its target population, followed by the FCT and Oyo State. Over the weekend, the UAE eased travel restrictions for passengers from Nigeria, South Africa and India, as it is now confirmed that it will start carrying passengers from these countries in accordance with the new protocols as from June the 23rd. In Africa, there are over 5 million confirmed cases of COVID-19 and more than 137,000 deaths on the continent. Globally, there are more than 178 million confirmed cases, while deaths have surpassed over 3.8 million. Meanwhile, the NCDC is advising Nigerians to continue to adhere to all non-pharmaceutical interventions to curb the spread of COVID-19 in Nigeria.
Sokoto State has not recorded a single positive case of the virus in over 100 days. The State Commissioner for Health, Ali Name, disclosed this while addressing newsmen shortly after the State's Council meeting. The Commissioner says a total of 15,600 persons have so far been tested and a total of 775 positive cases have been recorded. On the vaccination update, Mr. Name says a total of 27,427 persons have been vaccinated with the first dose of the AstraZeneca vaccine, while the second dose of the vaccination has since started and 12,461 persons have so far been vaccinated without any side effects reported.
There are now 102 days without a reported positive case of COVID-19 in Sokoto State. We don't have any person on admission or active case, as it may be called. And we have so far conducted tests on 15,644 individuals so far.
The Taraba State Primary Healthcare Development Agency has asked residents of the state to adopt proper waste disposal of personal protective gears in order to minimize the scourge and transmission of the COVID-19 virus. The Executive Secretary of the agency, Dr. Aminu Hassan, said this in Jalingo when speaking on the implications. He says the agency will not relent in its continuous education and sensitization on how best to dispose both solid and non-solid waste.
As far as immunization is concerned, not only immunization in the health sector, we have process of waste disposals, and we have been preaching that process to all concerned, particularly our health workers that are handling activities in the local government level. We do what we call segregation of waste, both solid waste and non-solid waste. And I want to believe in the health facilities, waste are properly segregated, incinerated, and properly destroyed. But as it affects the community, I think we need to do so much in trying again to educate our people on how to best to go about destroying their waste, either solid or soft waste. And I think it will also help us to minimize the scourge or the widespread of the viruses, not only for the coronavirus pandemic, but other communicable diseases. And I think it is to the best interest of all of us to imbibe the culture and the spirit of good sanitary waste disposal.
The time is apt for Africa to be the provider of solutions for its challenges, as it is endowed to do so. This is according to the Coalition for Dialogue on Africa, CODA, which is set to launch the independent task team on the development of vaccines and equitable universal access to vaccines and vaccination in Africa.
The coalition organized together with the Africa CDC, the Africa Development Bank, Afrexim Bank, and other partners, the Economic and Social and Cultural Council of the African Union in April, in 19 and 20 April, we organized a virtual conversation on the equitable access to vaccine and vaccination on the continent. What came out of it, of those 2 days conversation, was that Africa, as Ken put it rightly, should come up with its own solution and stop being at the receiving end of everything. We seem to be consumers of everything: ideas, concepts, definitions, medication, vaccines. So anyone out there can bring something. It will be considered to be at good standards and for Africans' consumption.
According to the World Health Organization, the Delta variant is in 14 African countries. Less than 1% of Africa's population has been vaccinated. 22 African countries experienced over 20% rise in virus infections in the week ending 13th June, while fatalities rose by 15% in 36 countries in the same week. With African countries reporting weekly infections, contingency plans, including enhanced surveillance, rapid testing and revamping, is critical indeed to ensure that the surge in COVID-19 infection is brought down. Joining us now, Dr. Prosper Haag, President of Africa's Pharmaceutical Forum, APF. He joins us now from Cameroon for more on the situation on the continent. Thank you for joining us on the program. Doctor, first, share with us your experience during, especially the peak of the pandemic and you know, in Cameroon there where you are. And this is also going by the numbers that Africa is recording now, and so far over 5 million cases.
Yes, more than 5 million cases all over the continent, which is, when you compare it to the figures of all of the world, it represents less than 3% of the COVID-19 infections. But what we have here in our continent is that the number of deaths is around 170,000 of cases of death, which means that we are still at the low level. But the main problem in some countries is how to collect the data, about the pandemic, the pandemic situation, and to provide them to the public. And that is one of the weaknesses that we are facing. The collecting evidence, it is a problem in our country.
Plus, there is the threat of, a third wave in Africa. Would you say that the continent is ready? And seeing as vaccination is quite slow.
Yes, there is a continued threat of the third wave. But Africa has continued to escape, as I told you, the worst of the pandemic. The reason, we don't know really the reason why we are doing less than the other part of the world.
So when we look at the pharmaceutical sector, what's your take on how the pandemic has affected that sector?
The pandemic has affected the pharmaceutical sector, mainly the supply chain. You know, we in Africa, we import all our products. The production of our product locally is very low. So importing masks, importing medicines, importing everything from Asia, from Europe, was very difficult. And we had countries where there was no mask. Imagine, no mask in countries, no medicines, nothing, no oxygen in hospital. That is how we were affected. And I think that for the future, as we are seeing now, is to reduce the level of importation, to become more independent by importing less and producing more in our continent.
But Dr. Hack, how do we do this? I mean, is it do we need a flexible regulation system? Is that missing? How do governments in Africa support indigenous manufacturing?
The government, all the government are realized that there is a problem, there is a weakness. We African, we should not be reliable to the importations. Now the regulation is changing. You have at the level of the continent, the Organization of Regulation, which is also the African Continent of Regulation Organization. And you have the AMA, African Medicines Agency, which the treaty is being supported now by many countries to improve the regulation, to improve the local production in our continent. And that there was a point before coming to me about the CDC conference of April on vaccination, producing vaccines in our continent, which was a very, very interesting conference, but with the objective, the aim that we can produce vaccine in our continent. We can produce more drugs in our continent. Imagine that some countries are importing 99% of their consumption of drugs, which is not normal.
We are looking forward to that time. We appreciate your time on the program. Thank you so much, Dr. Prosper Hack, President of the Africa Pharmaceuticals Forum, APF. Thank you for joining us on the program.
Thank you. Thank you so much for inviting me here.
We have more on the situation of the pandemic in South Africa and the rest of the world. Please stay with us. Welcome back. South Africa's Department of Basic Education is to embark on the COVID-19 vaccination rollout for all school teachers and staff in the sector. The Minister of Basic Education announced that the rollout will commence on Wednesday and end in July. Well, in preparation for the vaccination, vaccines are being delivered today to all provinces in the country. The minister says 300,000 Johnson & Johnson doses have been earmarked for those employed in the sector, and about 580,000 teachers are expected to be vaccinated within the next 14 days.
It will start the Wednesday, the 23rd, which is next week, and continue until the 8th of July, when we close our schools. We will be vaccinating all teachers in the PESA, which is our where we register our educators, administrative and support staff, irrespective of age. We'll also be vaccinating, this I thought I should raise because it kept on being raised in the morning. We'll be vaccinating even teachers who are school governing body appointed teachers and those employed by independent schools. That's why we also had a meeting with them to make sure that we have a comprehensive program of all the educators in the sector. In total, for the next 10 to 14 days, we plan to have almost 582,000 people in the sector vaccinated.
Away from Africa, the Australian Technical Advisory Group on Immunisation has recommended the COVID-19 Pfizer vaccine as the preferred vaccine for those aged 16 to under 60 years. This updates the previous preferential recommendation over COVID-19 vaccine in those aged 16 to under 50. Dr. Oluwadamilola Obawede, a medical doctor and postgraduate researcher in Monash University, Australia, joins us for more on this. Thank you for joining us. Why was the recommendation revised?
Thank you for having me, Millicent. That's a good question. So like you mentioned previously, the recommendation was that anyone above 50 years was able to receive AstraZeneca. But that recommendation was based on an initial estimated risk of blood clots of 46 per million following the first dose of AstraZeneca. However, this recommendation was revised because of the higher risk and observed severity of blood clots related to the AstraZeneca vaccine. So the observed severity in Australia in 50 to 59-year-old increased from mid-June or mid-April until now. We've seen about 60 confirmed or probable cases of blood clots that's associated with the first dose of the AstraZeneca. And this was seen in people between 50 and 59. So the risk assessment had to be revised, which led to the new recommendation that you only get AstraZeneca if you are above 60 years. But yeah, so I think the people getting above 60 years that have to get AstraZeneca, for them, it's just that the benefit of getting the vaccine, which will prevent them from getting COVID or getting severe COVID, outweighs the risk of blood clots.
Well, there is discussion ongoing as to the Delta variant, its pervasiveness in the UK, the US, Europe. Scientists say it's now 60% more transmissible than the Alpha variant. Are there any cases recorded in Australia?
Yeah, well, it's more transmissible. There are a few cases. So there was a recent outbreak in Melbourne about 2 weeks ago. And it started from supposedly a return traveler who was in hotel quarantine and all that. And yeah, he had the Delta variant. So now we have about 51 active cases in Melbourne, where some are Delta variant, some aren't. But also in Sydney, there is a Delta variant case, but the other cases in Sydney are not Delta variant. So we don't really have so many cases of the Delta variant.
How receptive are Australians to the vaccination and the different types that are being rolled out in the country?
Well, in my opinion, so since the recent outbreak in Melbourne and now in Sydney and in Brisbane, I mean, these are like major cities in Australia. So now people have been, they've started seeking to get the vaccine more, especially those that are older than 50, because majority of them were hesitant to get the vaccine before because they didn't want to get AstraZeneca. But now that, I mean, if you're less than 60, you can get the Pfizer vaccine. More people are seeking to get vaccinated. But I mean, regardless of this, only about 3.3% of the population have been fully vaccinated.
So essentially, I mean, it is work in progress with the vaccinations that are ongoing, but Australia is doing quite better than, some parts of the world. What do you think that perhaps some other countries can learn about Australia's method and its response?
Honestly, if you had asked me this question maybe 2 months ago, I would have said maybe we should learn from the snap lockdowns, or like basically how Australia is good at taking swift and concrete decisions. For example, the snap lockdown, like I mentioned, or border closure. But to be honest, I feel like at this point, everyone is tired of the border closure. So I guess at the end of the day, it's really taking swift responses and concrete decisions, really. Australia has really strived in doing that, and they've been successful at doing that, even if I wish they could open the border really soon.
All right, many thanks, Dr. Oluwadamilola Bawade. Thank you for your time on the program.
Thank you.
China has administered over 1 billion doses of its COVID-19 vaccines, a key milestone in the world's largest inoculation drive. More than 100 million doses have been administered in the 6 days up to and including Saturday. However, efficacy rates for the Sinovac and Sinopharm vaccines have been found to be lower than those developed by Pfizer, BioNTech and Moderna. It took China 25 days to climb from 100 million doses to 200 million doses in just 6 days, from 800 million to 900 million. This is according to state-run media Xinhua. Well, here's more on the global update.
Yes, so we agitate it gently.
Staying in the UK, British Prime Minister Boris Johnson says that travellers would face hassle and delays this year if they sought to go abroad, because the priority will be keeping the country safe from the coronavirus. Asked if the government was looking to ease the rules for those who have been double vaccinated, Mr. Johnson says that the government is looking at the option and that it was looking good for July 19th to be the terminus point for coronavirus restrictions in Britain, but did not flatly rule out the possibility of further lockdowns in the future.
When it comes to travel, we'll certainly be looking at that, but I want to stress that this is going to be, whatever happens, a difficult year for travel. There will be hassle, there will be delays, I'm afraid, because the priority has got to be to keep the country safe and to stop the virus coming back in.
So no guarantees on an exemption from quarantine from travellers who are double jabbed?
We're looking at it, but I want to stress that the emphasis is going to be on making sure that we can protect the country from the virus coming back in.
The Kremlin has described the coronavirus situation in Russia as difficult and says it's still deteriorating rather than getting better. The country reported 17,611 new COVID cases on Sunday, including 305 in Moscow, taking the official national tally since the pandemic began to beyond 5.3 million. Residents, however, do not seem worried about COVID-19, and some say they would prefer not to get vaccinated, as well as not wearing masks and gloves. Brazilian health authorities have kicked off a mass inoculation program on the island of Paqueta to test vaccine efficacy in different stages and the forming of large-scale immunization, just as the country recorded more than 500,000 COVID-19 deaths. With a spike in cases, the country is hoping to ward off infections with mass inoculations, scheduled to be completed in 8 weeks. The vaccination drive is designed to track the blood samples of the people involved to see if the vaccines are safe and if one dose alone could effectively curb the transmission. Finally, in the United States, leading epidemiologist Dennis Carroll has affirmed the trustworthiness of a study indicating that COVID-19 may have appeared in the United States earlier than the documented infection. A recent research study done by the National Institutes of Health shows that infection began in the United States at a low level as early as December 2019. The study is based on the 24,000 blood samples collected at the beginning of 2020.
Well, let's continue to take responsibility. You can visit our websites for better updates, or better understanding as well of the pandemic. You can find other stories there as well. It's channelstv.com. It's at your fingertips. That's the program this evening. Thank you for watching. I'm Millicent Walker. Stay healthy.